Assalamualaikum and a very good day to Prof. Zainal and my fellow friends. So today I would like to share with all of you about an an interesting field that you in the medical where you can pursue as your specialist in the next step. So before that, my name is FARIS YASIR and I would like to talk about obstetrics and gynecology. So have you guys ever wondered what is obstetrics and gynecology? So obstetric and gynecology usually you will heard about this during for pregnant woman, for baby. So what is exactly ONG? So obstetric and gynecology, or known as OBGYN, is a medical specialty that focus on women health, including the pregnancy, childbirth, and reproductive health. So there are two different things in obstetric and gynecology, which is obstetrics, the care of pregnant women, including the delivery of babies, and gynecology, which is the care of the woman's reproductive organs and health, including the diagnosis and treatment of disease and reproductive health screening. So we will move on to the table of content. So what I want to talk in this video is about the anatomy of woman reproductive organ, the physiology, the common disease and their treatment, and last but not least is the technology that we use in this field. So first and foremost, we will go for anatomy of woman reproductive organ. So basically, I think it is quite familiar for you all, the woman reproductive organ, as we learn it in during primary school and high school. So we go for structure and function of ovaries. The ovaries is kind of important things in the woman reproductive organ, where ovaries are almond-shaped organ that are responsible for producing ova and hormones, including the estrogen and progesterone. You need to know that each woman has two ovaries located on either side of the uterus, where it's playing a vital role in the menstrual cycle and reproduction. So next is the uterus and its role. So uterus is a muscular organ where a fertilized egg can implant and develop into a fetus. Its layer include the endometrium, myometrium, and perimetrium. Each layer play a specific roles during the menstrual cycle and pregnancy. And last but not least is cervix and vagina. I believe most of you has quite familiar with the cervix because there is a disease we call as cervical cancer that is among the leading cancer in the world, I can say. So cervix is connect to the uterus to the vagina and plays a crucial role in childbirth by dilating the during labor. The vagina serves as the birth canal and a passage for menstrual fluid, providing a pathway for sperm during intercourse. So next, we will go for physiology. When we talk about physiology, it is much about process. What happened in the woman reproductive organ, what happened during pregnancy. That is physiological things. So there's a lot of physiological things that happen in woman reproductive organ, but I take only three. First of all, we go for pregnancy. Physiology of pregnancy. So pregnancy triggers a complex physiological changes, including the increase in blood volume, elevated hormone levels, and altered metabolism. This adaptation actually prepare the body to nurture and support the developing fetus throughout the gestation. So as we can see at the picture, some of the hormone are quite important, such as progesterone, where it used for uterine realization, placenta growth, and breast development, while estrogen is used for uterine growth, labor preparation, breast development, and fetal development. So next, we will go for trimester and development stages. So what trimester is actually the divided into three, which is the first trimester, second trimester, and third trimester. So during the first trimester, it focus on organ formation. The second trimester, it focus on emphasis in growing of the fetus, while the third trimester prepare for birth, that showcasing the fetal maturation. Actually, you can see the trimester when a pregnant woman usually they will have a medical checkup at the clinic or hospital. So the doctor will explain about this trimester to the mother and what they need to do, what they need to eat for their fetal development. Last but not least is the common complication during pregnancy. Pregnancy is quite complicated because many things can happen during pregnancy. So pregnancy complication can include the gestational diabetes, preeclampsia, and premature labor. Early detection is very crucial in detection and management to ensure the health and safety of both of the mother and child. So next, we move to disease that is related to the obstetrics and gynecology. For your information, there's a lot of disease that is related to obstetrics and gynecology, but we cannot, I cannot include all on this slide. So I will talk only two, which is ovarian cyst and cervical cancer. And other than that, the we also have the disease like ectopic pregnancy. We have the hypertensive disorder of pregnancy, and so on. So next, we will go for ovarian cysts. So ovarian cysts are fluid-filled sacs on the ovaries, often harmless. They can be categorized into functional cysts such as follicular and corpus luteum cysts, and pathological type, including dermoid and endometriomas. So each with distinct origin and implication for health. So how we diagnose the ovarian cyst? We usually diagnose through pelvic examination and imaging techniques like ultrasounds. In some scenarios, blood tests may also be conducted to assess the hormone levels or rule out cancer markers, ensuring an accurate diagnosis. As you can see, the ovarian cyst is where you can differentiate the healthy ovary and the ovarian cyst, where the ovarian cyst is a bit larger than the healthy ovary. So next is cervical cancer. What is cervical cancer? Cervical cancer begins in the cells of the cervix, often linked to persistent infection with human papillomavirus, or known as HPV. We need an early detection through screening because it can lead to successful treatment and improve outcomes, highlighting the importance of regular gynecological checkups. So how we diagnose the cervical cancer is typically involve a pap smear to detect the precancerous changes, followed by the HPV testing. So further evaluation may include the colposcopy and biopsy, facilitating the accurate staging and treatment planning. So how we treat the cervical cancer and ovarian cyst. So, treatment option for cervical cancer are guided by cancer stage and including the surgical procedures, radiation therapy, and chemotherapy. So, emerging the targeted therapies and immunotherapy show promise in treating advanced cases, enhancing the survival rates. Next is how we treat ovarian cyst. It depends on the cyst type and symptoms. Options range from watchful waiting asymptomatic cysts to hormonal contraceptive for prevention, and in some cases, laparoscopic surgery to remove large or problematic cysts. That's why we need women usually at the age of high school. During high school, they will have the HPV injection, and they have a medical checkup for only girl, I believe. So next we go for last thing I want to talk today is about the technology that we use in this field. So I'm sure you all are quite familiar with the ultrasonography or ultrasound. Usually ultrasound it is used for monitoring the pregnancy, where it play a pivotal role in the monitoring fetal development and detecting the abnormalities throughout the pregnancy. It is considered a safe, non-invasive method essential for prenatal assessment. Usually you can see at the hospital or clinic where the doctor will put some gel on the mom's belly and put the ultrasound equipment uh, on the gel on the womb, on the mummy's belly, I'm sorry. So that is used to check the development and detect the abnormalities as we said. So if there are any abnormalities, the doctor can detect and can make early prevention for to avoid further things become worse. So next is hysteroscopy, where it is a test to look inside a woman's womb using a thin tube with a small camera inside it. The womb is where a baby grows in pregnancy. I think that's all from me. I hope this video helps you a lot, and thank you very much for watching. And I hope you are interested in joining the obstetric and gynecology field. Thank you so much.